Good afternoon. My name is Wendy Randall, and I am one of the consultant midwives at the John Radcliffe Hospital in Oxford. I'm here this afternoon for our monthly question and answer session about how best I can support you. Um, I'm I'm here if there's any particular questions that anybody would have, and I hope to be able to answer those. So I'm just going to wait a little bit of time for some more of you to join us. I can see that we've got 6 people so far, and then I'll repeat what I just said. So I'll just give you a few more seconds and have a little sip of my coffee, if that's all right, before we get started. Okay, so I think there are 10 of us here today, and quite often we find that as we start this, then people have similar questions that hopefully they'll get answers to from the beginning of the session. So for those of you that have joined since I introduced myself, I am Wendy Randall, and I am one of the consultant midwives at the John Radcliffe Hospital. My focus is on intrapartum care, which is sort of the labour and birth side of things, although I do spend time with women in pregnancy who need some specific help in terms of birth planning. So in Oxford, we are fortunate enough to have roughly 2.5 consultant midwives, but obviously there's 3 of us because we can't cut someone in half. And so there is Emily Brace, who is the consultant midwife who leads on public health. And there is Heidi Ottesen, who's the consultant midwife who leads on better births. So like I said, I focus mostly on sort of labour and birth, but the 3 of us do run clinics to help support women with their plans for birth when things are a bit more complicated, or midwives to help support women when births are perhaps a bit more complicated, as well as many other things. So every time I go on this, I have a new computer, so I'm not sure quite where the questions are going to come in, and I don't know if any of you have questions yet that you would like to ask. But there is a function where if you type in your questions, I will hopefully see them and I will read them out and answer any questions you may have. The general questions that we seem to get asked are what is happening in terms of COVID, what is happening with visiting, what is happening with partners in labour, etc., and basically what's happening overall. We haven't made any massive changes, so we're still very much where we the things that are important for us are please, we are asking you to wear face masks unless you have an exemption to do so, and your partners, especially when you come into the scan department, and have done your lateral flow tests. That's really important because there's not a lot of space in the scan rooms. You're in a small room for a period of time, and we need to make sure that we are minimizing exposure um, for our staff and obviously for you in terms of what we're going to do. So we don't want there to be any challenge between midwives or practitioners asking you to put on your masks. So we do ask people to please respect that, although what we're asking is different compared to if you walk in a shop in the high street. We are actually seeing pregnant women admitted with COVID infections and having to look after them, so it's still quite real for us. And it does have an impact on our staff. And if we have staff that get COVID and are at home, that obviously impacts on what services we can provide for you. So the key message is we haven't changed. We really want you to wear a mask. We really need you to do your lateral flow tests, and that will enable us to make sure that you, your partners can come in with you as well. Like I said, we don't want to get into the point that we're challenging people. In terms of the vaccinations, we are encouraging people to have vaccinations, and we are looking at providing vaccinations on a COVID bus type thing that we will have going round, and hopefully we'll have more information for you on that. And, obviously go talk to your midwife about COVID vaccinations. There is information on the Royal College of Obstetricians and Gynecologists website, as well as our website, and also on this Maternity Voices Facebook page. So I'm going to go down to some questions and hopefully answer other things along the way. So Laurie Betty, you're asking, is there a different protocol for birth centre and delivery suite? I'm not quite sure what you mean about protocol, Laurie Betty. I don't know, do you mean about COVID or do you mean in general? If I could ask you to give me a little bit more information, that would be really helpful. So hopefully we'll come back to that question. Emma, you're saying your family lives around 5 hours away. At what age could we start thinking of driving up with a baby? And how often would be need for a stop based on car seat safety? So Emma, I'm not sure what's generally advised in terms of a car seat and a young baby. It may be worth asking the health visitor about that. They may have more concrete guidance, but basically we do suggest frequent stops because it's the equivalent of how long a baby can sit. It's how long a baby can sit in a car seat, and then go flat again. And obviously it's better for the baby to be strapped in the car. So I wouldn't like to guess at what that is. And unfortunately, from our perspective, we're pretty good up to babies who are 10 days old. And then after that, we very much look to other people for advice. So I'm sorry I don't have that on the tip of my tongue, but I suspect your health visitor will be able to give you more information about that. I'm not sure, Laurie Betty, if you came back with some more information about birth centres and delivery suite. And Annalise has just posted, are there plans in place to review the visiting guidelines during COVID? So Annalise, at present we have, it is just a birth partner who can attend between 8 in the morning and 8 at night on the wards. Obviously they're there, your partner is with you throughout labour and birth. And then obviously from 8 a.m. to 8 p.m. We haven't taken the plans any further. We were hoping to open up more. When we started planning way back in June, our plan was to open up more this Monday. But like I said, we've had a few women over the last week who have been unwell with COVID and have been admitted because of COVID, because the people that are most at risk now are people in your age group, because they're the people that still haven't managed to get all their vaccinations or indeed 2 vaccinations. So what we don't want to do is create a bigger problem. And I'm sure you're aware that levels in Oxford are quite high. So we've decided not to open up any further at present, to ensure that we don't create more problems. What we don't want to do is get to a point that we have to reverse on anything that we've done. But part of our planning in the future will be to offer more options for visiting, for other people to come and visit, and plans for people's own children to visit, but we haven't got that yet. And we still, unfortunately, due to the fabric of our building, we are still having an issue with our lifts, which means that sometimes the lifts, we have lifts for the public, which you use to get to the scan department, etc., and to the wards, and we have lifts for the staff when we need to transfer women in labour, etc., between the spires on level 7 and delivery suite. And certainly over the weekend, we had an issue with the lifts that people couldn't get up to the levels. So we obviously have to reduce flow through the unit if we don't have access in terms of lifts. So Kezia, Kezia, I think you've responded, thankfully, to Emma So you said guidance is to stop every 2 hours for at least 30 minutes. And how old is your baby? You'd say that spending the first 2 to 4 weeks at home while you and the baby adjust to your new life together, but ultimately doing what feels right for you whilst considering the baby's needs. So, Kezia, that's great. If that's advice that you've been given from a healthcare professional, then that's brilliant. We just need to make sure that we're, making sure it's consistent advice. But thank you for helping me out. Laurie, so you've come back to say you'd like to know if a woman who's having a low risk pregnancy but labour didn't start at 41 plus 4, could she birth in a birth centre if labour starts before 40 weeks, 42 weeks? Baby's head hasn't engaged yet and induction is advised. I'm trying to see more of that, which is being declined. Believe baby's head can engage even in labour. Okay, so Laurie, I think the key things is what we believe is that people who are low risk have, the best place for them to labour and birth is in a midwifery-led unit or at home. If things aren't as we would expect them to be, that's why we do sort of an assessment to say, well, actually, what are the potential complications? So one of the things that we know is if somebody's having their first baby and the baby's head hasn't engaged, then that is perhaps a sign that there is something else that we should take into consideration. And we tend to say if the baby's head is not engaged in the pelvis and is high, that actually it's safer for them to birth in the hospital. If it's your second and subsequent baby, well, those babies bob up and down all the time, and so it's not quite the same thing if baby's head hasn't engaged. Um, and the option to decline induction is offered from 41 plus 3 weeks. And it's offered then because there is a very, very small increased risk of having a baby with a poor outcome, um, either a stillbirth or having uh, not having as much circulating oxygen as the baby needs. And like I said, that risk is only slightly increased, but it is still an increased risk, and that's why we inform women of it. So you can choose to decline induction and be induced at 42 weeks. You choose to decline induction even at 42 weeks and go as long as you want. But what we want to do is just have more of a detailed conversation with you so that we can share the information with you for you to make an informed choice. So I think it's very difficult to answer that completely, Laurie Betty. But what I would say is if you want to decline induction, etc., and get some more information, then please ask your midwife to refer you to a consultant midwife, and we can have that discussion in more detail with you. Annalise, you're just saying you're worried if you have to stay in, you won't be able to see your 17-month-old. Yes, we do. We do appreciate people really want to see their siblings. We'll do everything we can to get you home as soon as possible. And I'm not sure how pregnant you are just now, Annalise, but certainly access to people for their own children to come in is part of our plan that we are building towards. Emma, you haven't had your baby yet. You're just trying to think about um, planning for after you've had the baby, so that's great. You have asked, does thrush show up in regular urine samples done in pregnancy? I'm not sure if it's in my head or not. You can have some. Uh, uh, cells, and it will come back if it's picked up some cells within the urine specimen. If you are concerned that you have thrush, it is worth getting a vaginal swab done, just so that we can look in that in more detail. If you find that thrush is something you regularly have, then you can use some cream to help with that. If you feel it's more of an infection, you can talk to your GP about having some other treatment. If it's something that you're used to and you know that it's there, then you can just buy treatment over the counter. Laura, you're saying, are you open to negotiating individual exceptions to the one birth partner rule if there are exceptional circumstances? If so, how would you go about negotiating an exception? So Laura, what we have in terms of exceptions is um, we have uh, women who are particularly vulnerable, who are at high risk in terms of safeguarding, in terms of their mental health, people with learning disabilities. So we do work with those. So we tend to work with people like the adult mental health team. So if women are under the adult mental health team or the perinatal mental health team or CAMS, which is the children's mental health team, we negotiate with them. And women who are booked under our Lotus team, who again having some additional considerations, we tend to go individually with them. Um, and what we're trying to do is make it as fair a process as possible, Laura. So I would say talk to your community midwife, and um, see whether you require referral in to talk to one of the consultant midwives, or not. Um, then I have Sawaru. Do midwives use forceps and Von-2s in the spires if needed, or would mothers be transferred to delivery suite? So we do, midwives don't do forceps or Von-2s. If we feel that labour is slow to progress or we need some additional help, we would transfer women birthing people to delivery suite for some additional help down there. So Jessica, you're currently 40 weeks pregnant with your third baby. When would you advise to call the midwife? Um, so, uh, so you're planning on having your baby at the Cotswold Centre. So Jessica, when people are on second and subsequent babies, we say please call us when your contractions are happening regularly every 5 minutes, because that gives us more of an idea. So we roughly say every 3 minutes when it's your um, every 3 minutes when it's your first baby, but every 5 minutes when it's your second baby. If you've had a previous very quick labour and birth, it may be that it's better to call earlier, but please do discuss that with your midwife. Annalise, you're saying your baby is due in October. I'm due in October. He'll be 17 months when I give birth. Um, Sorry, Annalise, I'm not sure. I'll flick back to your other messages. Oh, I see. So what you're saying is that your other child will be 17 months when you're due to give birth. So things hopefully will have changed by that period of time. Because things are changing all the time, and we're hoping that the rates are getting better, and improving, and more people are being vaccinated, which will make a difference. So October is still a couple of months away, so fingers crossed, Annalise, things will get better. um, so Katie, you've been referred to the consultant obstetrician by your midwife after your booking in appointment to talk about labour and birth, but I was wondering why I haven't also been referred to a consultant midwife. You're very much like the opportunity to talk through birth options for your second baby. Um, so generally, the so your consultant obstetrician has referred you back to the midwife, I think, that booked you. So Katie, I would talk to your community midwife about it, and she can refer you on to me or one of the other consultant midwives if that would be beneficial. Your community midwives are amazing, and they're really good at putting into perspective what happened last time. What's the chance of any of that happening again? and answering any of your questions. And you might find that that's enough, but obviously if she feels like you would benefit from more, or then they will refer in to us. So go through your community midwife first, because they are a wealth of knowledge, and it may mean that you can sort that or sort of plan out with them, without needing sort of more input. So Lucy, you've posted, would you recommend the second COVID jab at 37 weeks? I recommend, Lucy, having the COVID jab, as soon as you're allowed to have it. We feel it's really important for people to still have vaccinations, as they would do normally. Um, because it's just about giving you a level of protection and cover. Because although people have been getting COVID from having had two vaccinations, it does reduce your chance of becoming ill. And that's the really important thing when you're pregnant, is trying to keep you as well as possible. Even though it's not going to give you 100% protection, it should help to keep you well. And we really don't want women to have to experience that if they don't have to. So I hope that makes sense. I'm not sure if there are any other questions that anybody has for me today, or any other information they may want. I think the key things for me are, we promoting having vaccines. We're promoting you still wearing masks when you come in from scans, to do your lateral flow tests. And it's all just about keeping you safe and keeping us safe as well. Chloe, you've posted your due plan cesarean section at the JR in the first week of September. What are the guidelines on how long your partner can stay after the birth? So Chloe, in the first bit, before we get on to the second bit, partners stay with you for the birth, and for roughly a couple of hours afterwards. If it's between 8 a.m. and 8 p.m. when you go up to the postnatal ward, your partner will stay and go up with you. If Which would be the case with a planned cesarean section. It will just depend on the recovery area. So if you go to the recovery area on delivery suite, you'll be up on the ward within a couple of hours, and your partner will just go straight up with you. If you are in the observation bay for a couple of hours, then it may be that your partner can go and have a break, something to eat, and return. But generally, it's hoped that your partner can stay with you 8 to 8 during the day. Abigail, you're saying, do you think pregnant women who are double vaccinated still need to work from home after 28 weeks? Abigail, it is something that we are doing for our own midwives. So all I can do is tell you that we've invested on them staying at home from 28 weeks. So I think that's the current advice that we're sticking to just now. Rose, you said, am I required to do a lateral flow test when I go into labour prior going into the hospital? So we ask you to do a lateral flow test before you come in for any hospital appointments and scan. When you come in labour, if you obviously haven't had a chance to do it before you go in, we do a lateral flow test and a PCR on you in labour. So unfortunately, it's 2 swabs, but it's just trying to make sure that we see exactly what the extent is of what's happening. So one is the one that you do yourself, and the other one is the one that goes to the lab test. And we do really encourage your partners to have done the lateral flow test before they come in. Erin, you just asking, do you know when we'll be able to have 2 birth partners? So Erin, it's one of these things that when we've looked at what it is women are requesting in labour, more often than not, people are requesting, they want, they've got their birth partners with them on the postnatal ward afterwards from 8 till 8. And they want to have visiting so that their children can come in and visit them in hospital during that time, so they're not delaying the point that the family meet them. Some people want their mums, etc., mums and dads to be able to come in and visit the baby because they're on the ward. So we've been focusing on those aspects to begin with. Um, and um, and then the second birth partner would be one of the things that we would bring in after that. So we're trying to prioritize the key areas that we've had most comments and feedback about. And whilst we know that some people are really keen to have two birth partners, um, you know, it's you've always been able to have one, which is a bonus, and people have been having the second birth partners on social media. Um, so we're trying everything that we can, but we're not quite at that point yet for second birth partners. So like I said, we're just trying to make little changes and not do anything too big, and because we don't want it to impact on the other services that we can provide, and we want to keep everybody as well as possible. Emma, you're saying, do you do a lateral flow test and PCR on your birth partner when they come in for labour? Uh, no, we ask you to do a lateral flow test, for your partner to do a lateral flow test, but we do a lateral flow test and PCR on you, because that gives us more of an idea about whether you know, your partner will be the same. Um, so I think that may be the answers to all the questions that we have so far. So I know these are little short question and answer sessions that we have, and hope that people find it valuable. We are looking to resume some antenatal education sessions, again, so that because we appreciate not everybody has the option for private antenatal classes. So we're just in the planning phase with that, with the Maternity Voices. I think they've asked a question on their website to see what it is people would like the information for. So hopefully one of our midwives will be leading those sessions for you, coming up, and then look out for more information on um, our COVID vaccine bus that we're going to have out and about as well. And really it's just encouraging um, people your age to make sure that they have the vaccines. Kim, so you're saying, so doulas are not able to support at the JR yet either? No, Kim, doulas are not at present unless some people are choosing to have doulas instead of their partner, because people are sometimes using their partner for looking after their other children. So at present, it's just one birth partner just now. Um, Samantha, what would happen if a partner tested positive for COVID when labour starts? We would ask your partner to stay at home and self-isolate, and for you to bring another birth partner if that's the case. You know, it's about reducing the risk of infection for our staff and for other people round about. Um, and obviously, you know, if you our partners, some of our rooms don't have windows in it. So, you know, if your partner is COVID positive, there isn't the ventilation to be able to support sort of open windows, etc. So I know that is less than ideal. And this pandemic has had a massive impact on all things. But we would ask them not to attend, so that we can keep our staff safe, as well. Hannah, you said your midwife has organised a prescription for omeprazole to take during labour to decrease nausea and vomiting as you struggle with your last labour. I wonder how effective you found omeprazole for this purpose in birth, and if you think it's worth getting anti-sickness wristbands or any other remedies ready. I do think omeprazole is good to take in preparation. We do have we do have injections that we can give you as well. Some women, when you're in labour, would benefit from having the injections regularly to help keep that at bay, especially if you found that you were very sick in your last labour and birth. And your midwife can write that into the plan for you to have an intramuscular injection to help support you. Because obviously, if you are being sick or feeling sick, you know, your tablet may not, you might not be able to have your tablet because you might be sick. So we have got other medications that we can give you to support that. So I think I'm going to finish up for today. And like I said, we'll be in touch with via this page to let you know any other changes, etc., that are that are going to happen. Hannah, if you're planning to be at home, then please talk to your community midwife, and we can or your GP, and we can have injections available at home for you, one way or the other. Okay, well, thank you very much, everyone, for taking part today. And any other questions, please do ask your community midwife. We will endeavour to get the answers for you. Take care. Bye.